current COVID-19 pandemic seems unlikely to be over anytime soon, with experts predicting either several overlapping outbreaks or another ferocious wave later in 2020. The medical experts say everyone is at risk of getting COVID-19 if they're exposed to the virus, but some people are more likely than others to become severely ill, which means that they may require hospitalization, intensive care, or they may even die. If you are pregnant and worried about how this deadly virus can affect you or how to protect yourself and your unborn child, stay with 84 TV Radio. Coming up on this episode of Wellbeing, we'll take a closer look at COVID-19 and pregnancy.
Hello and welcome to another enlightening episode of Wellbeing here on 84 TV Radio. I am Adira Yosenami. You do agree with me that the year 2020 is turning out to be a not normal year. COVID-19 has ensured that. And so every day we learn a new thing, we learn more about COVID-19. And so protecting ourselves and others from spreading the virus is our utmost priority. But there are some people amongst us who are vulnerable. Medical experts say that COVID-19 affects people with underlying health conditions. I have a guest in the studio this morning who is going to enlighten us about the specific people who I can imagine living in these times is a scary one. Every time they watch the news, they're probably, afraid and they don't know what to do. I'm talking about pregnant women. I want to ask my guest, who is a consultant, gynecologist, and obstetrician. I want to ask my guest if COVID-19 affects pregnant women differently. Dr. Henry Nwadu, it's a delight to have you back on Wellbeing. Thank you so much for doing this. Welcome to the program.
Yeah, thank you for having me.
Okay, without further ado, COVID-19 is here, and it's going to be here for a long time to come.
Yeah,
and medical experts like yourself have said that COVID-19 affects us differently. I want to ask if pregnant women fall into that category. Does COVID-19 affect pregnant women differently?
Okay, thank you for asking that question.
Yeah.
It's important to state that COVID-19 is a new virus, and some of the evidences of some of the reports that are coming up are actually preliminary reports.
Yes.
Some of them, the power of the studies or the power that is backing up the studies are not really very strong. But of course, these are what is available and we have to make do with it.
Yeah.
Now, emerging evidence or recent findings have shown that pregnancy does not predispose a woman to contracting this disease. Neither does pregnancy advance or affect the course of coronavirus in a pregnant woman. Very important.
Yes.
So pregnancy is not a risk factor for catching the disease. And pregnancy does not make you have a severe disease if you catch this disease. So pregnancy is not one of the risk population or one of the populations at risk of severe morbidity and mortality in COVID infection.
Okay, thank you for establishing that.
Yes.
It's very important because every day a pregnant woman tunes into the news. They say, don't go to the hospital, stay at home, avoid, and many of them, because of they know they are carrying life inside of them, they want to stay indoor, observe all the necessary protocol. But what happens when a pregnant woman really has to go to the hospital? What should she do?
Yes. Okay. I also want to say that from preliminary results or from the data available, it has shown that COVID-19 does not increase the risk. Because the reason why a pregnant woman is afraid is, if I get the disease, what happened to me? What happened to the baby? So before I delve into that, let me establish this fact again too, that coronavirus infection in a pregnant woman does not increase her chances of miscarriage.
You have just answered all the questions, but please go on, Dr.
Does
Henry.
not increase her chances of miscarriage.
Yes.
Her chances of preterm delivery.
Yes.
Prematurity, and then other associated both maternal and perinatal mortalities and morbidities that are seen in pregnancy.
Yes.
Coronavirus does not increase the risk
of pregnancy,
apart from the one that you have as an individual.
Okay.
So that is a fact. So that fear or that uncertainty of what will happen to me, or how will I feel, or how will I fare, especially, because pregnancy, in quote, is known as one of the immunosuppressive conditions.
Yes, because
Yes, because all the people like in malnutrition, people on chemotherapy, people that are having cancers and all that are at risk. But available studies have shown that pregnancy does not affect the cause of the coronavirus, does not affect the risk or does not increase the risk of all these abnormalities I've mentioned or complications in pregnancy as at today.
Okay.
Yes. However,
yes,
I also want to mention that there are some physiological changes that occur in a pregnant woman.
Yes.
Especially in the third trimester, which is the last part of pregnancy.
Yes.
That can make her experience or have difficulty in recovering from this virus. Of course, you know, in the third trimester, a woman's abdomen is very big. Okay, her respiratory excursions are highly reduced. Yes, because of that, so you can imagine a woman that is having a little bit of what they call labored breathing at that stage, because of flattening of the diaphragm, because of the effect of the pregnant uterus on the lungs and on the diaphragm. Then you now have a superimposed coronavirus infection, especially for those that end up having the acute disease, the severe disease. They now find it very difficult coping with this condition, and the chances of adverse both maternal and perinatal outcome are increased. But as a result of what? The physiological changes, not primarily because of the virus in them. Yes. So that is the reason why they are concerned. But this, like I said, available studies have also shown that the incidence of what I just described now is still very low.
Okay, thank you so much. Okay, so since the COVID-19 started, have you had some of your clients come, your patients come in? Have you taken delivery of babies?
Yes, I do. Yes, I have.
Okay.
Of course, COVID-19 is here, but it doesn't affect her.
It doesn't stop. Everything continues.
Yes, our normal life. Even when the COVID-19 was at its peak, you understand. Of course, women that were at 10, you can't stop their labor from happening. Neither will they come to the hospital, tell them that you will not go and deliver them because you are afraid of catching COVID infection.
Yes.
So we have everybody, every society, including ours, have devised a means of continuing our normal life, carrying out our normal day-to-day activities amidst the raging virus.
What are some of the protocols that you've put in place to encourage more women to come? Because I'm going to go to the part where we live in a society where pregnant women, they come for all the antenatal classes, but on the day of delivery, they don't come to the hospital to have their babies. So what are some of the protocols you've put in place to encourage more women to come to the hospital to have their babies in spite of the raging virus?
Yes. Okay, you just mentioned a very important fact, and which I have to emphasize on, because from the 2016 National Demographic and Health Survey carried out in Nigeria, it showed that about 68% that Nigeria has achieved 68% antenatal care coverage.
Yes.
69. It means that 68% of our pregnant women actually comes for pregnancy supervision or antenatal care in a qualified health facility.
Yes.
That's what it means. But this same study also showed that out of this 68%, it's only 38% that delivered in a hospital that have skilled birth attendants.
Wow.
What that means is that delivered in a hospital that has somebody who is attending to them, has the knowledge and skill to deliver them and also detect early onset of complications with the aim of either treating it or referring to a bigger hospital.
So most women, they just come to take all the lessons, take all the medicine, take all the knowledge, and then they say go back to...
Exactly. During the delivery, they still go back to their maybe traditional birth attendants, to their pastors, to their villages, to their mothers, even at home.
So I can imagine that COVID-19 will now make them to stay away from hospitals more.
So your guess is as good as mine. So with this type of problem scenario already, despite the awareness, despite the fact that they come, they attend the classes, they understand the importance of hospital delivery and all that, majority of them don't come. Then you now add the burden of COVID-19 in. Of course, you can imagine what the outcome will be. But nevertheless, we are still doing our part to encourage them to come out, because that is the only way they can be saved. This country or this part of the world has one of the worst maternal mortality and morbidity indices. True. Together with perinatal morbidity and mortality indices. So our women are dying from pregnancy and pregnancy-related complications. And COVID-19 will not stop it. So the COVID-19 rather have intensified all these parameters, all these indices I've been mentioning. And that is not a very good picture. But like I said, on our part, we're doing everything possible to encourage these women to come out. Because these problems are still there. These challenges are still confronting them on a daily basis. Women bleeding after birth, what we call postpartum hemorrhage, still remains the #1 killer of every woman that are delivering after pregnancy. and so many other complications such as hypertensive disorders of pregnancy, pre-eclampsia and eclampsia, that's hypertensive disorders of pregnancy. Then we have puerperal sepsis, which is infection following delivery, problems of obstructed labor and its complications, as well as abortion and its complications. These problems are still in our society. So because the COVID infection has taken attention and has drawn every other person's attention to itself, we tend to now neglect and play down this with what attendant morbidity and mortality rising on a daily basis.
You're watching Wellbeing here on 84 TV Radio, and on this episode we're talking about the impact of COVID-19 on pregnancy, and that's what our guest Dr. Henry Wado has been enlightening us on. Don't go away, we'll be right back.
A housewarming is a party held to celebrate moving to a new house. The origin of this word goes thus. A long time ago, before the 1800s, when central heating was invented in the Western world, housewarming was a tradition where invited guests gathered in a new house, contributing firewood to burn in the fireplace and warm the house up.
So we have 2 more questions and then we'll call it a wrap. But yes, you can go on and answer the question. What are some of the protocols that you as medical personnel have put in place to encourage more mothers to come to the hospital to have their babies and for their regular antenatal visits? Because what I hear from pregnant women is that I call my doctor will tell me, what to do, that some of them don't physically present at the hospital. Is that okay? Or do you encourage certain days of the week that you dedicate to them, which is what the normal, way? They have Tuesdays and, different hospitals with different protocol.
Yes.
Yeah.
No doubt the antenatal care or the antenatal program itself has undergone a lot of modification as a result of the pandemic.
Yes.
Because of the preventive measures which are already in the national guidelines, such as social distancing, limiting the exposure to public places and all that, then hand hygiene, wearing of face masks, all that are in place. And that has also affected antenatal care. Now we tend to reduce the number of visits to the ones that are absolutely necessary. Yes. This, of course, has its side effects, but then you can't help it. And then there are some other types of consultations that has also come in place, which we call virtual consultations. You understand, where you do teleconferencing or video conferencing with a pregnant woman, especially if she's feeling fine and maybe she's just coming for a routine check and refill her medications. Such can be done over the phone, and they have her medications delivered at home. But periodically, we still, of course, they still come for their normal, because you can't do, for instance, physical examination with virtual consultation.
Beats me.
Blood test, maybe ultrasound scanning, fetal monitoring, or BP check, even for the mother, using virtual consultations. So definitely we encourage them to come. We do this by, first of all, counseling them on some of the things I've mentioned, how coronavirus affects pregnancy and how pregnancy affects coronavirus, which I have stated there, that it is not different from their non-pregnant cohorts matched for the same age. Do you understand? There is no difference. Studies have shown that. So that you're pregnant does not increase your risk of susceptibility of getting this infection. Neither does it make you to run a severe course if you get it, compared to somebody at your age that is not pregnant. So demystifying this alone is a very important step. Then another one is reaching out to them. You understand, especially when we see them, we do what they call tracing. You understand? We do use our telephone to trace them, find out why they're missing appointments.
To check up.
To check on them and remind them of the antenatal visits. For those that have these kind of challenges or questions and all that to answer, that is an avenue to answer all those questions and encourage them to come. And then it is only then that we realize that the antenatal care is not for the sick. Because some of them will tell them, because I was not feeling anything, because you understand, I don't have any problem. But they don't understand that in pregnancy, this is one condition in life where symptoms, signs precede symptoms. What that means is that I can check your BP as a pregnant woman, and your BP can be 200/150, and yet you don't feel anything. So to you, you can relax at home. I'm not feeling anything. But the next time, in the next 1 minute, you can start convulsing. So because they don't understand that, then that is an avenue to make them understand that pregnancy is a unique condition, because this kind of conditions occur in pregnancy only when symptoms are present, complications have already set in. Yes. By the time you start convulsing, or you can't breathe as a result of acute pulmonary edema, or you notice sudden vaginal bleeding, all that complication has already occurred. Good. But if you can make yourself available and I check your BP and discover your BP is high, I can give you medicine immediately to bring it down and avert such complication. So using television conversation, teleconferencing, encouraging them, home visits, you understand, we try to do all this to motivate them to come for the antenatal care, because it still remains number one intervention to reduce maternal mortality and morbidity in our environment.
When you were speaking earlier on, there was one profound statement. I mean, that COVID-19 does not, does not increase your chances of miscarriage. Does not cause miscarriage. And it does not mean that a pregnant woman falls into the category of the immunocompromised. No, COVID-19 does not do that. Yes, but you said if a pregnant woman does come down with the virus, because I mean, it's a pandemic. Yeah. And I'm sure there have been cases of pregnant women coming to the hospital or who have been isolated, with COVID-19. What should one do? What should she do, in that instant?
Okay, for identified cases, suspected or confirmed cases of COVID-19, we still have laid down protocol, which are part of the national guideline for attending to this group of patients. Yes. First of all, if it is a suspected case, maybe you have had close contact with a confirmed case, or there are close contacts in your family and all that, you're supposed to call in advance and notify your primary healthcare provider that you have such challenges. Yes. Do you understand? And then while you're coming to the hospital, you should try as much as possible, you understand, to come in a private vehicle. You understand? And then on getting to the hospital, you're supposed to alert the medical staff even before you enter the gate that you are either a confirmed case or a suspected case. And then the healthcare providers or the healthcare team who are dressed in their proper personal protective equipment will receive you, attend to you in an isolation room. Do you understand? Yes. So such people are attended to in isolation. It doesn't stop the normal antenatal care. Yes. Because the woman is still at risk of so many things that could kill women during pregnancy and childbirth. Yes. And the baby too stands the risk of dying if those things are not corrected. Yes. Do you understand? So that you have confirmed case or you have a suspected case does not stop the normal antenatal protocol. However, universal precautions or laid down precautions which are in line with the national guideline must be followed in attending to such patients. Such patients must ensure that they wear face masks or face shield during the consultations. Then, of course, I have mentioned that the primary caregivers should use appropriate PPEs to attend to these women. You understand? Every other thing that needs to be given to the woman needs to be done. But maintaining that principle of social distancing, as well as good hand hygiene, use of face masks, and then disinfecting shared surfaces. Yeah. This is not a place where other health staff can just stroll in and stroll out. You're a place where you now have, maybe if you use the materials that you use it for other places. And then for surfaces that are shared, such as staircase, doorknobs and all that, they are sterilized periodically to ensure that the transmission of the virus does not occur in the health setting. We know that pregnancy already is a condition that is filled with a lot of anxiety, a lot of uncertainties, because nobody knows the way or the direction the pregnancy may play. So already the women has a lot of psychological and emotional challenges then added to the pandemic. But then it's also important to mention, that's just like I stated earlier, that the presence of COVID-19 in a pregnant woman is not a death sentence. It does not increase the rate of miscarriage in them, then that it doesn't increase the rate of preterm delivery or other perinatal mortality and morbidities that are seen in the general public. That the risk factor that they face is still comparable to any other person who has that infection, who is pregnant but without COVID-19. So it is not a death sentence. It does not predispose them to severe disease. It does not affect their pregnancy adversely. But then they have to take action. Taking action to prevent this for themselves from contracting the virus by ensuring that they do practice all that is outlined in the national guideline. Then for those that have the disease, practicing all the things that I have mentioned above in terms of the antenatal care, but making sure that they do not miss their antenatal care or their contact with the primary healthcare provider, because that is the only way that they can benefit from all the advantages of antenatal care, especially in this part of the world where maternal mortality and morbidity are on the rise.
Thank you. And so that's a wrap on this episode. Thank you to our delightful guest. It has been a very informative episode of Wellbeing here on 84 TV Radio. The United Nations Secretary General has said that the world is facing the most challenging crisis since the Second World War, and that, it's a pandemic that cuts across to almost every country across the world. I only have one advice for you. Please adhere to all preventive advice. Thank you for watching Wellbeing here on 84 TV Radio. My name is Adirayo Senami. So we'll meet again next time. Bye-bye.